Right, today on TJ's Tuesday Tidbits, what we're going to do, we're going to talk about ear infections, alright? This happens a lot in kids, right? So what happens with ear infections? Well, there's lots of different kinds of ear infections that can range. You got, what they got, chronic otitis media with rhinitis and all these different, big word names, okay? But basically what it comes down to is fluid draining out of the ear. Is there an actual infection or is there not infection? Is it just inflamed? Okay, so those three things can cause similar type of symptomology. So when children are developing, we have what's called eustachian tubes coming from the inner part of our ear and lead down into the back of our throat here, okay, or the sides of our throat. So fluid will go into that ear, and actually air transfers from inside that eustachian tube up into the inner ear, and air transfers from outside of the ear so that there's a common balance of air pressure. Now what happens when that eustachian tube becomes closed is you start to lose that balance and you get pressure in the ear. In children particularly, those eustachian tubes, which should be pointed more downward in adults, are actually a little bit more parallel in kids, okay? So that means that fluid doesn't drain out as well. You don't have as much airflow going through there, okay, because of these differences in just the way they are set up anatomically. So that's why kids are more prone to ear infections. Now, what do we do or what can be going on? Well, we need to check, see if there's any fluid retention, because just because the ear hurts and it's maybe red doesn't mean it's an infection, okay? It just could have a lot of pressure. So we need to make sure that's just fluid retention, okay? Number two, is it an actual infection? And that's where a trained physician comes in and looks and sees whether there's an infection there or not. Some docs take another step and they take a culture to see what kind of bacteria might be going on in there. Because if it's a bacterial infection, you need an antibiotic to calm it down. Or you need some type of intervention. One thing you have to be careful of is if it's a true infection and there's a bacterial viral agent going on, you don't want that to start to spread to the inner ear where the child can then lose some hearing and it'll be permanent. That's a problem, okay? So if you're suspecting an ear infection of some sort, take them to a trained physician, whether it's a pediatric chiropractor or their pediatrician or a naturopath, whoever you need to make sure that that is not a full-on ear infection, or at least to monitor it so it doesn't, so that's not going to get worse. Okay? Or if it does get worse, you have the right intervention. In chiropractic realms, we can't necessarily do an adjustment and get rid of the infection. Okay? Sometimes you need some help with that. That's where the antimicrobial oils comes in handy. Antibiotics can be useful for those types of things. If it's fluid in the ear and you're having percussion mechanisms with your tympanic membrane or your eardrum, chiropractic can work beautifully for that, and that's where we do very, very well. So if your kid has chronic ear infections and you take them to the chiropractor and they adjust and they get better, that's why, okay? And that's why chiropractic can work really well. Teething can cause ear infections, or not ear infections, but ear pain, okay? There's medical articles that show that teething doesn't cause ear pain, and most of those articles are written by medical doctors in the residency who don't have kids. Okay? If you have kids, teething can cause ear pain. Trust me, I know. Okay? My daughters have had a lot of ear pain. None of them have ever had an ear infection. And one reason that we can account to that, big study came out, dairy, particularly milk, is notorious for causing ear infections. If your kid has a lot of ear infections, you need to cut dairy out today. Okay? That dairy is an inflammatory protein, and that can actually cause that eustachian tube to constrict, and now you're not getting rid of the fluids or allowing air percussion to that tympanic membrane. So take home message from us right now. If there's one thing you're going to do and your kid has chronic ear infections or even an adult, cut out the dairy, particularly milk especially. Cut that out, get rid of it. It probably is going to help. Maybe it doesn't fix it, but it's probably going to help. Number two, if you think it's an infection, or you suspect, or the child has a fever, or any of these things going on, take them to a physician right away. They need to get checked. Okay? Number three, if it seems like it's not as much infection, and they're maybe just pulling on their ears, it's a little discomfortable, and they don't have fever, or they're teething, get them into a chiropractor. There's homeopathic drops. there's adjustments, there's things like that that can work really, really well. Make sure they're pediatric trained, okay? Now we're still on this pediatric topic. We're getting a few suggestions coming in, so next week I think, with the start of school, we're going to be talking about some ADHD, which we do a lot in our office, okay? So if you're interested in some ADHD with your child, and you have some questions or anything like that, start shooting them our way. We'll cover them in the next video, all right? Again, this was ear infections. If you have any questions, foldafamilychiro.com, 507-425-0025, or my wife, Dr. Sarah Gravers, over in the Edgerton Clinic. And that's 507-631-7565. She does wonderful jobs on ear infections and ear issues with pediatrics, okay? Give her a call if you're closer over that way. Thanks a lot, everyone. Hope you have a great week. We'll see you next week with ADHD.